Hi everyone, you're welcome to Dementia 12, and today is going to be about possible causes of dementia. There are a lot of stuff to talk about. I have 42 possible causes on my list. Okay, let's go. The possible differential diagnosis are Parkinson dementia, Alzheimer disease, normal pressure hydrocephalus, dementia with Lewy body, frontotemporal dementia, multi-infarct, Huntington disease, Wheezing disease, CREUTZFELT disease. As far as this page is concerned, only two, the Parkinson dementia and multi-infarct, that you will not be able to find on my channel. The rest are already produced. So I have presentations on the rest. Check my channel. The differential diagnosis will continue. Like, is this hypothyroidism? And in this case, I'm going to talk just a little bit about, because I've not made any separate presentations on all this. Okay, in case of hypothyroidism, are you feeling cold more than necessary? In case of anemia, do you notice any bleeding or anybody telling you you are pale, or feeling dizzy, heart racing, and so on? Dehydration, any diarrhea, vomiting recently, or decreased intake of fluid? And is it that you are having fever, or just questions broadly? And vitamin B12 deficiency will present with confusion and neuropathy and pallor, because it's going to be a form of anemia, megaloblastic anemia. And decreased sodium, that is hyponatremia, with confusion and so on like that. Another possibility could be HIV, and what we need to do is know the HIV status of this patient, because there's possibility of HIV dementia complex. And is this meningitis, any fever, neck stiffness, rigidity? If you do physical examination, Kenny sign and Brodzinski sign, so we're going to rule that out. Or neurosyphilis, any physical symptoms and signs, and venereal disease, research lab test. Can this be hypercalcemia? Is there any hyperparathyroidism, feeling thirsty the more or peeing the more? Any pain in the tummy? Just the features of hypercalcemia. Is this increased sodium, hyponatremia? What's the value of the sodium telling us? And is this renal failure with blood urea nitrogen value, creatinine value? And is there pallor because of decreased erythropoietin? They're just continue to rule out everything that is possible. Could this be hepatic encephalopathy, any flapping tremor, any itching somewhere, jaundice? Just get the value of glucose in case of hyperglycemia, and you do the same, the value of glucose in case of hypoglycemia. And differential diagnosis could continue as subdural hemorrhage, because the individual could have fallen and have end injury a long time ago, but is now presenting with confusion and like, is this delirium? Then we need to find out. Is this fluctuating? Any withdrawal of medication recently? Any alcohol, delirium tremens, and so on? Schizophrenia, any hallucination, delusion, catatonic behavior, and so on. Is this depression? The mood is down, psychomotor retardation, feeling guilty of anything, anhedonia, and so on. Is this stroke? You just stretch out the hand for pronatal drift, dysarthria, drooling, and history of stroke or not. And of course, you're going to make the physical assessment as well. And a CT, non-contrast CT to rule out hemorrhagic and ischemic and any history of transient ischemic attack and the like. Other possible causes are sepsis, particularly in elderly, that may present with confusion, loss of memory, and so on. And drugs, might be street drugs, might be medications because of polypharmacy, some are sedating, and some like anticholinergic, all different types of medications. Grief is another issue that could make anybody appear as if they are confused. And of course, vascular dementia, thyrotoxicosis, hypoxemia, and alcohol all could be presenting with confusion and kind of memory impairment for the time that they are passing through these various situations. But these are all treatable conditions. In conclusion, the question is, can we get the exact cause or the exact diagnosis? The answer is not far-fetched. Yes, we can. And if we're able to do that, there'll be less unnecessary interventions, and we'll be able to avoid some medications that are not acceptable in some individuals with a particular type of dementia. And I'll give just one example here. Like first generation antipsychotics like haloperidol is contraindicated in dementia with Lewy bodies. So we need to get the exact cause. And normal pressure hydrocephalus with ventricular shunting, surgically done, we are going to have better life. By the time you even do your lumbar puncture and you withdraw CSF, you will see that the ataxia or the abnormal gait will become corrected. And with that, less need for many medications. So the best thing is get to the root cause. Thanks for listening to my presentations. I think with this, I'm going to end the series on dementia, dementia 1 to dementia 12. Kindly subscribe so that you can get many other presentations that will be published. Thank you.